Hi, I'm Debbie Myers Martin, the State Representative of the 38th District, and I am proud to bring the stroke awareness legislation to the public of the Chicago Southland, where every second counts when it comes to strokes. It was important to me to bring legislation to the General Assembly because at one of my first public appearances as a state representative, a nurse approached me to say how important it was to create an awareness of the stroke condition, what needed to be done, how important timeliness was. I believe that information is power. And so in the Chicago Southland, it is extremely important to me, as well as my colleagues who are working with me on the stroke awareness campaign, that we bring this information to the public, that they know what the symptoms are when someone is having a stroke, that they understand that every second counts and they must address stroke in a particular way where we will now make sure the patient is going to a stroke-aware hospital, where they can deal with the symptoms and they can deal with the stroke victim in the proper and correct way. And that is what I feel is the importance of this legislation. Information that will be powerful in our communities. Information where disparity has created a space where we are not informed. We do not know what our rights are. We do not know where and when and how we should address health care. And so the stroke awareness campaign is extremely crucial to the sustainability of our healthcare space here in the Chicago Southland. I believe that since COVID, we have all become so aware of the disparities in healthcare in particular regions. And I must speak to the Chicago Southland region in particular. We know that we must improve the healthcare outcomes that we see in the Chicago Southland. Having this legislation be a centerpiece of where we go in the future as it relates to healthcare is something that I'm very proud of, and I'm very enthusiastic because we know that it will make a difference in the everyday lives of the people who live here in the Southland. And I'm happy to say that the Department of Public Health actually is very interested in expanding this program throughout the entire state, which means that all Illinoisans will be able to benefit from this valuable legislation. It is so important for all of you to be engaged because one person can make the difference. One person can go back to their family and share information that they've learned by being engaged in this stroke awareness campaign. You can go back to your community and share with your neighbors, with your friends. And so one person can make the difference. And that is why we are reaching out to everyone who lives in the Chicago Southland and eventually beyond to the entire state, to make sure that you are engaged because you can make the difference. I want you to get serious about strokes because every second counts.
So let's start this conversation about stroke. What is a stroke? How does it happen? Well, a stroke occurs when there's a disruption in blood flow to the brain. And it can happen in two ways. An ischemic stroke is a stroke that occurs when a blood clot or other blockage obstructs blood flow to a part of the brain, and that can happen in about 80 to 85% of people. The other type of stroke is very different. It's called a hemorrhagic stroke, and in this type, a blood vessel ruptures, leads to bleeding in the brain, tissue, or its surroundings. The question now is, well, why did a stroke even happen? Well, a stroke can happen to anyone at any age, but they're more common in older people. Not only does stroke increase with age, but it also increases if you have risk factors such as high blood pressure, diabetes, atrial fibrillation, or heart disease. Other important factors such as obesity, smoking, a sedentary lifestyle, And excessive alcohol can also cause a stroke. So you're probably thinking, okay, well, how can I prevent a stroke? Well, you can't change your age, but you can make a few adjustments to your lifestyle. If you were put on a blood pressure medicine, take the medicine. You have to know your numbers. If you're smoking, you've got to stop. Talk to your doctor about enrolling in a smoking cessation program. And if you're drinking, reevaluate how much you drink and decrease the amount. Now, if you're sitting too much, get up and walk. Walking is the best exercise you can do, and if you aim for 150 minutes per week of exercise, put walking in that regimen and walk it out. Once you start to move around, you may notice that your appetite or types of food may change. And this is where eating a diet in low sodium, low in fat, low in processing, and high in fruit and vegetables is really important. Not only do all these changes in lifestyle help to keep your heart healthy, but it keeps your brain healthy, and this could prevent cognitive or memory changes that occur after a stroke. Did you know that about 30% of people who've had a stroke develop cognitive and memory changes after a stroke? Some will even develop dementia. So by focusing on risk factors I just spoke about, you can also reduce the risk of developing cognitive memory decline after stroke. All of these things are doable, all of these things are achievable, and you can do it. So in the Chicagoland area, we see a lot of stroke, and we see a lot of stroke in different neighborhoods here on the South Side. So one of the things is that if you know the signs of stroke, you have to act fast. But once you've acted fast and you're in the hospital and the workup for stroke has occurred, now is the time to think about, well, what were those risk factors that got me into stroke? Some of them I named before, but a lot of them occur here on the South Side in our communities. It may seem overwhelming that, oh my goodness, how am I going to manage all this? But you can. The high blood pressure that we see here on the South Side, it can be managed. It can be managed with medicine and knowing your numbers. The sedentary lifestyle that we're often seeing with many of our adults, not just older adults, but that can be managed too by just walking. The diet issues that we see where people are saying, I don't know how to eat healthy, I don't know what I should eat. Talk to your doctor about diet and see how you can swap out some kind of foods that are more fried for more fruits and vegetables. These are all the things that are affecting our communities here on the South Side, and all of these things are modifiable. All of these things we can work together to make sure we have healthier communities.
My name is Leslie Scaleras. I'm a doctor at Northwestern, and I take care of patients who have had a stroke. As a doctor, I'm the person who identifies and treats your stroke and then helps you on your road to recovery. So our first goal when a patient comes in the emergency room with stroke symptoms is to identify if we think that this is a stroke, and then if they're our candidate for acute stroke treatments. We know these treatments work better the faster that they're given. So what happens is a whole team of doctors, nurses from neurology, emergency medicine physicians, radiology, sort of come down and descend on the patient and evaluate them quickly to try to assess whether we have acute stroke treatments that can help the patient recover from their stroke. After in the emergency room, the patient will then be taken to our stroke unit, where the goals shift to trying to identify, number one, why they had a stroke, and number two, what we can do to prevent them from having another stroke. After our evaluation, patients are either discharged home or to acute rehabilitation, where they start the process of recovering for their stroke. We'll then see the patients back in clinic to make sure that we're doing everything we can to prevent them from having another stroke and helping them recover from the stroke that they've had. We are often evaluating strokes in the emergency room, and we're trying to identify if the stroke is due to a blockage in blood flow called an ischemic stroke, or if the stroke is due to the bursting of a blood vessel called a hemorrhagic stroke. And the way that we do that is one of the first studies that patients will get when they come to the emergency room is a CAT scan, and where we can start to differentiate those types of strokes. One of the key things that I want you to know is that strokes are treatable. We have medications and procedures that treat strokes much better than we did 10 years ago. And these treatments work better the faster that they're given. So one of the most important things today is to recognize the signs of stroke. And if you see them, whether you're at a supermarket or a church or a park, is to call 911 and get help as soon as possible. The acronym to recognize stroke symptoms is FAST. F-A-S-T. F is for face drooping. Ask the person to smile. Does one side of their face droop? A is for arm weakness. Ask the person to raise up their arms. Does one arm start to fall down? And S is for speech difficulty. Ask the person to repeat a sentence. Is their speech slurred or words mixed up? T, time to call 911. Call 911 right away and get to the hospital as soon as the symptoms start. The most important thing is to get to the hospital as soon as possible. We do recommend calling 911 and getting an ambulance for a couple of reasons. Number one, it's often the fastest way to get to the hospital. Number two, the ambulance will notify the hospital that the stroke patient is coming, so the stroke team is ready to take care of you as soon as you get there. And number three, sometimes stroke patients get worse after having a stroke, and this is the safest way to get to the hospital.